Welcome to episode 7 of Meenal's World. A big thank you to everybody who tuned in to the last episode and those who've messaged me as well to let me know they've understood the seriousness and implications of this pandemic. We are now in day 5 of lockdown in the UK and I still feel a bit uneasy about how people still don't understand the idea of social distancing, but I really hope with more media coverage, more people talking about it, people will understand, and hopefully after this episode you'll see the countless number of people in the healthcare system who are working so hard to make sure that we're all safe. And now India is on day 4 of their lockdown as well, and obviously I don't live in India, so I can't really say how much about it and if people are following the rules or not, but I can certainly say that implementing strict lockdown rules has instilled a fear in people, and I think extreme measures is the only thing that will give people the wake-up call and control this pandemic. So my husband and I are still working, and I still can't remember the last time we sat down to have dinner and watch a full episode of a TV show without talking or worrying about this pandemic and the virus. But I've had sleepless nights, mainly because I feel like I'm struggling to carry out my role as a doctor. The whole idea of being a doctor and coming into healthcare was to serve our community and fight for the lives of our patients, but we're so limited with our resources and even knowledge about the virus. A lot of patients are asking me questions about how the virus will affect them, how it will affect their own family members, and whether the world will come rather soon. And the truth is, we just don't know enough about this. I know a lot of doctors have isolated themselves from the children. They've chosen to live in hotels to protect their families. Some doctors have even gone to the extent of writing their wills because we fear that in the fight for saving lives, we might even lose our own. And we always ask the same question, why has it boiled down to this? And the answer is really simple. If we had tested everybody from the beginning, maybe our numbers would have been controlled. And vaccines and treatments and all of these things, is great that they're looking into all of this, but these things take months to come into work, into action, and sometimes even years as well. And the one thing that was possible, the one thing that was probably quite quick and easy to do, which was testing, wasn't done. And I've said this before and I'll say it again. I don't blame our hospitals. In fact, yesterday our consultants arranged a webinar to answer all our questions as junior doctors and concerns, and I think they did an excellent job to put our minds at ease. And we must understand that they're following guidelines, they're following management, who are following the government, and we're all stuck in a system. And things are changing on a daily basis, even an hourly basis. But our consultants and our team have worked very hard to understand that everybody has individual needs. Some doctors are pregnant, some doctors have children at home, some doctors have been exposed to COVID-19, and everyone is really pulling their strings together to make sure we're all happy to work in the environments we're put in. But just to put into perspective, I was looking up pandemics that have hit us in the past century, and we have to remember that these things take years to recover from. It's not a case of 1 month of isolation is going to fix it, 2 months of isolation is going to fix it. It's going to slow it down. It's not going to fix anything. If you look at Ebola, for example, the epidemic which hit West Africa, it was only cleared after 3 years, and this was just one region of a continent. So it's really important that we understand the impact that this can have in the next few years. Please don't look at it as a solution, as something that will be solved in the next month or two. It will take some time. But amidst all of the chaos, the media, the uncertainty, I really want to use this episode to talk about the healthcare professionals working to fight this pandemic. Doctors are working at the front line. We also have doctors who are taking all the emergency phone calls to direct patients to where they need to go. We have medical students coming in. Medical students might even graduate as soon as next week now. We've got radiographers who are x-raying and scanning all these patients and exposed to these patients. And they might not even have enough masks available. I also have a psychologist joining me as well. And he talks about how he feels the doctors and nurses working right now, how this will affect their mental health, not just now, but in the coming few months as well. So my first guest to join me is Dr. Nirja Joshi. She's a GP trainee in London and was supposed to sit her final exam this week, which would have meant that she would have qualified as a GP consultant. But all of that has changed. She's been called into service and helped the NHS. So have a listen to this, because remember that doctors are not just dealing with COVID-19 and the pandemic. We still have to deal with skin infections, heart conditions, and cancer patients as well. So thanks for joining me, Nirja. I understand you've had a very busy shift today, so I'll try and make this as quick as I can.
No worries.
Yeah. So Nirja is a GP trainee. She's almost at the end as well. And if I'm correct, you were supposed to do your final exam tomorrow, right?
Yes, that's correct. So I was preparing for my final exam in general practice, which is essentially our exit exam. And that has pretty much been cancelled until September. So everyone's exams have been cancelled, both written and practical, going forward. And that's actually the case for all colleges in the UK.
So does that mean that your qualification as GP is delayed as well?
So actually, I was reading the updates about this today. There's no specified guidance as to what's going to happen going forward. There are obviously lots of discussions happening at a very high level as to what to do, because the training and progression of lots of doctors will be affected by this. So obviously the current pandemic is taking precedent quite rightly, but they haven't given us any assurance as to what's going to happen. But it's certainly discussions that are taking place.
So Nirja, if you're not on your study leave right now, what have you been asked to do to help the NHS and to help the government with this pandemic right now?
So I'm currently working in general practice, which is primary care in the community. And actually everyone in primary care is pitching in a lot and working any hours that are needed to help the surgery to function. As with any service at the moment, we are suffering with staff shortages due to sickness and people having to isolate, which is understandable. But all of the staff, and myself included, are picking up any extra telephone calls, appointments and things that need to be done to help the team.
Yeah. And what does your day look like right now?
So actually, it's a really interesting time to be in general practice. It's completely unprecedented, the challenges that we faced, but I'm really grateful to see how reflexive everyone's been in terms of the changes they've managed to make. So in the last week, we've gone from seeing all of our appointments in a traditional face-to-face way to setting up telephone consultations for all of our patients. And we're now seeing a bare minimum of patients that need to come in. And we are actually managing some patients through video consult, which is completely brand new for us. But it helps us to physically see patients, and that gives us some idea, especially in, for example, children, how they're behaving or their respiratory signs, and that's really helpful. So to see how much everything's changed in the last week is incredible, and it's only through the efforts of everyone working together that's happened.
Yeah.
So you asked what a typical day looks like right now. Is essentially trying to make sure that patients have adequate supply of medications, those with chronic diseases and the vulnerable, so they're not worried about having to venture out in the weeks to come, and also ensuring that people are safe and trying to stay at home where possible. So we're just giving people advice and ensuring that the majority of people try and stay at home.
And how are you updating prescriptions, and how are people able to collect these? Because obviously we're trying to avoid contact. So how are you doing this electronically then?
Yeah, that's a really good question. So actually, all of our prescriptions are now converted to electronic prescriptions.
Okay.
And we're using 3 nominated local pharmacies, which all have their own policies on delivering to elderly residents or limiting patient numbers and contacts. But actually, physically in the surgery, we're seeing the bare minimum of patients, the people who have to come in for wound dressings and things like that, or stitch removal. But aside from that, we're really trying not to bring anyone in.
So, Nirja, you just mentioned patients coming in for wound dressings, and these are all essential things that still need to take place, because we cannot forget that apart from the COVID-19 pandemic, we still have other things that are still going on, right? I mean, patients need chemotherapy, patients need wound dressings changed. People are still suffering from heart diseases and chronic diseases. So are you worried that at some point in the next few weeks, all of that will be pushed to the side and the main focus will just be on the virus, because it might get to that point where we are just overwhelmed with what's happening?
So I think things actually have been, I mean, I wouldn't necessarily say pushed to the side, but they have certainly been somewhat sidelined for now, because actually the services just aren't available. So the laboratories are prioritising coronavirus testing, which means that routine testing of things like blood tests, urine tests, they're not able to do them. So a lot of chronic disease management or even acute disease management has had to change in its style, and it will have a knock-on effect. I'm certain it will have a knock-on effect. However, I think our main priority is to keep patients safe and at home where possible. So if a problem can wait for a couple of weeks or months, then we must keep these patients safe, because it's more important for them to stay home and reduce their risk of contracting anything than them coming out to see us for what might be a very, very not necessary review at this time, essentially.
Yeah. And what do you think about how the government has done to sort of speed things up and make things easier for you? And you said now that you have telephone consultations, even video consultations. Do you think that this is something that we should have implemented in the NHS some time ago? Not just because of this pandemic, because we've always had an issue with the burden of patients and the burden. Burden's maybe not the right word to use, because obviously we're here to help everyone, but we do have an overflow of patients coming in. It's difficult for us to keep up as doctors. Do you think that this is something that has sort of saved the NHS in some way?
So I think what is great to see is the fact that people have worked together and so quickly. So a lot of red tape was taken away quite quickly, and that's kind of the only part that I would say the government played in the management in primary care, because actually GPs work as small businesses, so their decisions are very much within their own surgery and the network of GP surgeries in that area. So although government has some impact, of course they do, a lot of the decision making has to be made locally. But thankfully, the red tape was removed quite quickly, which allowed people to be very adaptive and make those changes very quickly. I mean, in terms of the question of should we have had this set up already, I guess what was helpful was that the primary care in private medicine had used telemedicine a lot. So there was a good amount of research and data and knowledge about it, but it just hadn't been implemented in the NHS. So I think what we've learned from this will certainly take forward. I mean, for example, some GPs today were working from home. Now, if you would have told me a week ago that was a possibility, I wouldn't have believed you. So the fact that there's so much that can be done now, I'm certain has opened doors for the future of how we work.
It seems like all of this has brought a lot of good things out of it. And we talk about how the NHS is struggling now to keep up with the number of cases coming in. Hospitals are understaffed, and we're struggling with beds and PPE and all of that. But I think if we just remind ourselves that we are capable of rebuilding everything that might need help with right now, and the rebuilding of the NHS is something that's going to happen over the next few months. And I think what you've just mentioned is a very positive thing. Even old people who are older who might not be able to come into the GP because they're restricted in terms of their mobility and traveling, now they have that option where they can call in and they can get their prescription. It is something that is an option right now. So it's really nice to hear that side of GP practice where you're still capable of helping everyone right now, even if you can't have that patient contact. But are you worried, Nirja? Are you worried at any point that they might call you into A&E and say we need doctors on the front line?
Yeah, no, absolutely. I mean, I'm not worried about it. I've accepted it many weeks ago as a probability as opposed to a possibility. One thing they have said is that people in my position who are nearing the completion of GP training may be best placed still stepping up within the community setting. So I think general practice has a huge role to keep people out of hospital, which is almost as important as the people treating people in hospital. Yeah. So to avoid inappropriate referrals and things like that, and community management is a huge part. So if there is major sickness within the senior GPs, it would make more sense for someone in my position to step up from our normal duties there. However, I have accepted that it is a probability that this will happen. I'm lucky that I'm not too distant from my hospital skills. And I think generalists are really well placed because they've seen, different cases from paediatrics to geriatrics and everything in between. So I think we're quite well placed to treat patients in an acute setting if we have to. And I've just accepted that that's part of our responsibilities as duties of a doctor to help people in this current situation.
So, just a last question for you, because I know you've had a long day, but what's your biggest concern right now? I know there's a lot going on, but is there one thing that worries you or bothers you, or one thing that you feel optimistic about?
Well, I might just push you to two things that I feel worried about right now. I think the first is that people aren't taking social distancing seriously.
Yeah.
That's my first concern. And my second concern is that 10% of infections in Italy were in healthcare workers. And we see the pictures of them, and they're all wearing full protective equipment, much greater than what we have. And although I'm hearing that the government's getting things to us, etc., what worries me is that in Italy they had all of that, and still they had a 10% infection rate in health workers. So if they had all the equipment and they got 10% of their COVID cases were healthcare workers, what chances do we have in the UK if we're not having the adequate equipment? And it really worries me for the infrastructure of the staffing of the NHS. Because unfortunately we have the warning. We've seen how it plays out. We know how this ends. And unfortunately the steps haven't been taken in good enough time, I don't think. So although I'm having a good experience in primary care, I know the eventuality, and it's not looking great, and I'm saddened by that, truly saddened to see people not taking their part seriously, particularly young people still congregating in parks and on the street, despite the warnings of our government and Prime Minister.
Yeah.
So that's my current feeling.
Do you feel, because Nirja, I feel that we've been working as doctors, you've been working much longer than I have, but do you feel sometimes that you've sacrificed so much for the NHS? We've given a lot of our goodwill to the NHS. Do you worry that a lot of healthcare workers will run out of that goodwill at some point, purely just out of frustration and lack of support?
I honestly don't think they will, and the reason that I say that is because I'm looking at these doctors in Italy, and they are all exhausted and they're working incredibly hard. But I heard one interview which stated that yes, they're run down, yes, they're exhausted, yes, they're emotionally very upset, but not once did they complain. And I feel like that is the kind of system in which we live in the NHS, because people are born into the NHS and people pass away with the NHS, and we're there for every moment in between. And I think that the teamwork and structure in the NHS will provide that support for the majority to get through. I mean, I'm sure that there will be people that lose that goodwill. I'm sure that will happen in any sense, but we have a duty in our profession. And all that I've heard so far is stories of people stepping up and out of their comfort zone. In fact, I've heard of multiple GP trainees who have actively volunteered to go into intensive care, A&E, acute medicine, because they've had previous experience. They didn't wait to be asked.
Yeah, no, that's amazing, Nirja. And I think
reassuring.
Yeah, and I think my biggest hope right now is that people don't forget this in 1 year's time or 2 years' time. Because the media is praising us, they're calling us heroes, and people are going to stand on their balconies and clap for us, and that's great. It's all very welcome at this time, but just remember, in 5 months' time or 6 months' time, in a year's time, in 2 years' time, we're still going to be doing this on a daily basis. Maybe not to this extreme, but we still show up to work every day. We still show up for our patients, and I just hope people remember that. So I hope you don't burn out too soon, Nirja, and I hope you take it easy. And I hope you have a better day at work tomorrow. Just take care of yourself and take care of your family. So Nirja did tell me that she ended up working from home, and it seemed to work. So who knows? This could be a turning point for healthcare workers and how we see our patients. it could be a positive outcome from this pandemic. So for this episode, I had to bring Raveen back. A lot of you may remember her from my first episode. So Raveen is very grateful to be part of the private system, and thankfully for now, her treatment has not been affected by the pandemic. But a lot of oncology patients who need chemotherapy or immunotherapy have been told that they may have to wait because the hospitals are entirely focusing their staff and resources in dealing with the pandemic. I never thought I'd bring Raveen back on the show in this way, but I'm really happy we could hear her point of view during this time because she is a vulnerable patient, and the Prime Minister did say that vulnerable patients have to self-isolate for 12 weeks. So Raveen, thank you for coming back again. I never thought you'd come back in this way. But thank you for joining me today again. And I think it's really important that people understand the impact this is having on people in the vulnerable group, such as yourself. So how did you feel when Boris Johnson said that people in the vulnerable group need to stay at home for 12 weeks?
Well, if I'm honest, the first time that I heard that, I was okay with it because I've basically been in isolation since September. But then it actually sunk in and I was like, actually, this is real. This is honestly going to be very hard. And that was also a reminder I'm actually high risk, that this is a very severe, because I think at the beginning there was a list of vulnerable patients and then it was shortened in the next speech, and I obviously got the text message. So it's very scary, because obviously me going out here and there is a luxury for me. I was in the hospital. So even the idea of 12 weeks is just very daunting for my mental health as well. But I think it's not that. It's more me being high risk that proves to be more of a problem in my head, because it's just obviously a reminder that this is serious, like very serious.
Yeah.
And 12 weeks is obviously a lot. And that's just right now. And we're not even at the peak of it.
Yeah. But Raveen, even before this came out, were you still told to try and isolate as much as possible anyway because you were on chemotherapy?
Yes. Yes. Yeah, I would say so. I was told, especially during my chemo days, chemo weeks, I'd stay at home because my immune system's low, I wouldn't travel with a tube. So I'm kind of exposed to that life already. So I was told, but I think there's one thing, it's another thing when you're being told you can't go for this X amount of time.
Yeah.
And it's just serious.
Yeah.
And it's not just because of your illness, it's because of a virus that you cannot control.
Yeah.
On top of whatever you have. So I think it's just increased risk, which is quite daunting. And the fact that it's very new and no one knows how to treat it, no one knows if anyone's got it. There's so many different factors that makes it a lot more harder than being told you've got cancer, you get treatment. This virus is a whole new ball game.
Yeah. Well, Raveen, you're blessed in the sense that you are able to get your chemotherapy through a private system. And I hope that hasn't been affected at the moment.
Yeah, so right now I'm on immunotherapy every 2 weeks. So I had it last week, and before that we just had to check that everything was fine to go ahead, and it was. So far so good. We haven't been told anything, but hopefully it's not, because I'm hearing about a lot of patients that have obviously had their treatment cancelled and it affects the whole process of cancer, because it has to be done on a certain schedule. So I'm really hoping that's not the case. But I think I'm also scared because I'm due to have a stem cell transplant later on in the year, and that probably won't go ahead, and that needs to be done straight after treatment.
And
that's also something else I'm stressed about.
Sorry to interrupt, Raveen, but is a stem cell transplant going to be done privately as well?
Yes.
Okay, so how why will that be affected if it's private?
Because I'm at risk and they won't take in, because there's already a problem with stem cells because I'm having a donor.
Right. Okay.
For my own stem cells. So I've really been reading a lot about how people are waiting. I'm not sure about it that much, but I think you need it needs to be given through a person. It
Okay.
obviously can't be done, and obviously with the current climate, it's quite hard.
Yeah.
The people are going through the process and now have to stop, which affects their treatment. It's really daunting just how it's going to affect people's health in another way as well.
Yeah. And are you concerned that the NHS right now is overwhelmed, is overworked? Doctors are being called in from retirement. Nurses are being called in from retirement. Medical students are going into the hospital to work at the front line as well now. Are you worried that the sort of workforce will spill now into the private sector? Do you feel that the NHS will need resources from the private sector, which eventually may affect you as well?
I think less about me, more about, I think, cancer patients that are at a more serious stage and like need their treatment.
Yeah.
So I'm not really thinking about me, but then all in all, I feel bad for the NHS because you're getting retired people back in the workforce, and they're surely vulnerable to an extent as well.
Mm-hmm. I said the same thing as well.
Yeah, and it's very scary because you're getting doctors and nurses that aren't being checked. They're most exposed. So worry about their health, because they are on the front line ultimately, and they are exposed to everything and anything, and they don't even know about it.
Yeah, we don't. We're going in completely blind into work. We don't know what's coming our way, and it is very scary. But Raveen, if you've been told to isolate for 12 weeks, what is it like living with your family? I mean, are you isolating from them as well? Are you staying in a separate room? Are you not able to have much contact with them as well? I mean, how much precaution are you taking?
Yes, so I have to be like 3 footsteps away from family. I have to use my own cutlery, my own bathroom, and literally everyone needs to sanitize. No one can really go out, which obviously now that we're in lockdown isn't a problem. But it's weird being a high risk patient. Very weird, because it feels like I've really got one illness.
Yeah.
I'm also like exposed to another, and it's because of my immunity at the end of the day.
Well, Ravina, I think now the issue is that my father, for example, if his boss told him you had 2 weeks of holiday, he'd be like, yeah, great. But now he's like, now they're like, you have to stay at home for 2 weeks and you have to isolate. Yeah.
When you're told you have to do something, it's not as great. Like, the idea of staying at home for everyone is scary, of course, and it's boring. It's like, what do you do? I don't want to sit and watch TV all day. But you do that if you would take time off.
Yeah.
But I also found it's very frustrating how much people would get annoyed by staying at home, and because it's like people like me have been doing that for the longest time, and it's not easy because it does affect you mentally as well.
Yeah.
It's healthy to have a balance, get out of the house, meet different people. I totally get that, but it's very selfish because I don't think people understand the fundamentals, which is it's not you. Well, you are at risk, yes. Even as a young person, you are at risk, but which people tend to forget. But you're also impacting other people, and you're passing it on unknowingly because obviously symptoms don't come up for 14 days.
Yeah.
So it feels like a lack of education or understanding.
I think it's a lack of preparation, a lack of a lack of sense of community that we're dealing with. A lot of people have done really well, Raveen. A lot of people have stayed at home, and I'm very grateful for those people who took that step even before Boris Johnson mentioned anything last week. Very grateful for those kind of people. But even on the weekend, there was a photo I saw on Twitter where you had a cyclist going around Richmond Park. And you're just like, it's not a bank holiday. It's not a weekend. It's not Easter weekend. You need to stay at home. So I think that sense of community needs to come about. That sense of not even just a community as the UK, but a global community. We all need to step up and help each other because everyone is going to be affected by this in some way or another. Everybody, whether you're a doctor, whether you're a patient or someone in the vulnerable group like yourself.
But I think generally we become desensitized to people in another country. So, for instance, with Italy, the state of Italy right now is crazy. But I think because it's not near home, it doesn't hit us. Because when we hear about the cases in the UK, the deaths, that's when we're like, wow, this is actually serious. Like, this is affecting us. Like, for example, with China, that was going on for the last few months. But
it seems so far away. It seems so far away that no one really thought about it. And now when it's come here, then people are panicking. But Raveen, just going back to what you said earlier about staying at home for 12 weeks now, and having to focus more on your mental health. How are you coping with this time? Because it's not just isolating yourself, it's also the lack of knowledge that we have right now. We don't know what's going to happen. We don't know how things are going to turn out in the next few weeks. You don't know what's going to happen with your own treatment as well, as you mentioned, regarding your stem cell transplant. So how are you coping in that way?
I'm doing good, if I'm honest. I feel like there's ways to combat your mental health during these times, especially, which is important in terms of like setting a routine, exercising, also getting away from it at the same time, because we don't know what's going to happen, because things are changing daily.
Yeah.
So I just don't plan anything anymore, because we don't know what's going to happen in the next few months. So there's no point of me stressing about not having a stem cell, whatever, because there are also so many other people in the same boat. So I set a routine. I'm doing things that take me away and that focus on myself, because I can't control those other aspects. I can't control the virus. So I think it's quite pointless if I was to stress over it, because I don't know what's happening. My doctor hasn't really been in contact with me. So it's
probably because he doesn't know what to say, or he doesn't know what's going on.
Yeah, we're all in the same boat. No one knows what they're doing. We're just trying to get by, especially the doctors, bless them, and the frontline workers and key workers. But I think everyone's in the same place. Everyone's feeling anxious. There's so much uncertainty.
Yeah.
But do you know what? On the bright side, the weather's good, and it's nice that we can talk to one another about it, because everyone's feeling a similar feeling.
Yeah, and even this discussion now has made me happy as well. It's made me feel better, just having that communication and just knowing that we have friends around us to take care of us. And you made a really good point, Raveen. I think just control what we can control our routine, control what we put in our bodies, what we eat, what we drink, our exposure to the sun, for example, like today, and then everything else will just happen as it goes along. So thank you for joining me again, Raveen. I will. I know I always said I want Raveen back on the podcast, but I didn't expect it to be this way.
Yeah, definitely not. But thank you for your work. We really appreciate it.
Thanks, Raveen. Raveen is at home for 12 weeks during this time, and the coping mechanisms are so important for her mental health. And remember, not only is she dealing with cancer treatment, but the world is going through so much right now. She's taking it day by day, and I think that's something that might just help us all at this point. So we have doctors, nurses, all working at the front line, but we cannot forget there are so many other healthcare workers risking their lives for us. And Kaylee, my next guest, is a radiographer. She's a friend from back home in Gibraltar, and she tells me that she's been x-raying people's chests who came in with just routine infections. They ended up showing a COVID-19 picture on the x-ray, and she didn't have the right equipment at that time to protect herself. So her point of view on this is very interesting as well. So thank you, Kaylee, for joining me. I know you're on your shift now, and you just squeeze out the last 10 minutes of your break, whatever you have right now, to speak to me. So thank you for joining me, Kaylee.
No problem.
So Kaylee, you're a radiographer. You are working at the front line, just like everybody else. Your role is quite different to mine. My husband as well is working in A&E as a doctor, but we haven't heard much about what you guys are doing as well. And you guys are just as exposed as we are, if not even more, because you are seeing patients on a daily basis. So if we just rewind back a few days, what was it like a few days ago working as a radiographer and dealing with patients coming in who needed chest x-rays or who needed any scans done? Were you expecting those people to be COVID or query COVID? Did you have any idea that it would escalate to this point now?
Definitely not. If I go back to like a week ago, everything was just it went from literally like 0 to 100. It went from, just every day in A&E, just normal days, to then people coming in with coughs, fevers, and then, because of the news, more and more we're hearing about more cases. And obviously, because we're an infectious diseases hospital in London, we get most of the cases that go to straight to ITU, ventilated, and, the really poorly ones. But through A&E, because everything is, you probably know from as being a doctor and seeing them coming through A&E, you don't know what you're going to get. So sometimes they come to us, and back a week ago, they would come in for a chest X-ray, or just with a cough, a fever, or whatever, do the X-ray, and then you'd see the appearance in the chest X-ray, and you'd be like, "Oh, this doesn't look normal."
Yeah.
Show it to someone, and then it's like, "Oh, that looks like COVID-19." So, and then you're like, "Okay, well, I was just exposed to that." A couple of days on from about maybe a couple of days ago, especially at the weekend, just before the weekend, everything had to be like complete change, because the mobile X-rays in the wards went from maybe 10, 20 a day to maybe 40. Like,
wow.
It's honestly insane. The amount we had to get a new mobile machine to, to allow us to go up 2 at a time, to the whole of ICU is basically got patients with COVID-19. The wards are basically ridden with it, unfortunately. And because, it's like I said, because we're an infectious disease hospital, it's where everyone comes.
Yeah.
So they've now had to, at the moment, coming to the beginning of this week, because everything's a bit more organised, because they've really sat down with all the heads of each department and thought about the process of people coming in through A&E, coming to X-ray, to CT. I think they've now managed to sort it out where basically the whole of A&E is classified as dirty. So everyone who comes in through the main entrance of A&E is for query COVID or positive COVID patients. And the whole of A&E X-ray and CT is all classified as dirty as well. Now, anyone who is sort of in terms clean, inverted commas, or like just a normal, anything else, nothing to do with COVID, they would go to, now it's like the physiotherapy department, which is on the same floor as A&E.
Yeah.
And they get triaged there, and then they get sent upstairs to the outpatient department, X-ray and CT, so that they're not exposed to the same sort of patients as the dirty area sort of thing.
So essentially, you've had to divide the hospital into dirty and clean to allow patients to come in. But Kaylee, if you go back to a few days ago, and you were saying that you could have been exposed to these patients who turned out to be COVID-19 positive, I assume you weren't wearing any protective masks or PPE, right?
No, definitely not.
And
I could like count with more than 2 hands how many patients I've been exposed to and not had anything at all.
Are you concerned that like no one has tested you yet, or there's not enough tests to go around, obviously, for healthcare workers? So what kind of impact has this had on your sort of just daily routine and even your own mental health? Because I feel like we're all going into this war zone with this anxiety, not knowing what's probably definitely creeping up inside us, and not knowing who we're in contact with either.
Yeah, I think so. Our managers have been very, good and open with, making sure that we're all okay, and our anxiety is literally skyrocketed. I think I'm on night shift tomorrow, and I've got the anxiety. I've got the nerves already thinking about going in and not knowing what to expect.
Yeah.
And I think everyone's pretty much feeling that pressure and that anxiety, like I say, and we've got people off sick already, and we've had people already off sick with what sounds like a bad case of COVID as well. So it's sort of that mentality of it's only a matter of time that it's going to get to me, because I go every day with getting into contact with someone, PPE or no PPE, but either way, you still have that at the back of your mind, which sometimes makes the symptoms come out anyways.
Yeah.
You're thinking, oh God, I've got a bit of a headache now. Is that not to do with anything, or is it just stressed? Or
I sneezed this morning, and I almost had a panic attack.
Yeah, honestly, anyone who coughs, you're like, are you okay? Fever? No.
But Kaylee, are you covered with PPE now? Like, are you all happy with the equipment you have now, or are you still struggling to keep up? Because there are some hospitals at the moment where I've been told that they've been asked to reuse their surgical masks. And obviously surgical masks are not made for that purpose. They're not supposed to be reused. They're supposed to be disposed immediately after contact with the patient. But what's it like in your hospital now and your department? Are you fully covered?
This week, I think we've got the stock coming in of PPE and we're making packs and things ready because I think the worst is yet to come, unfortunately, from what I've seen and heard.
Yeah.
So I think everyone's preparing and making packs and using all the stock as much as they can.
Yeah.
So I think we're trying to keep minimal use of this PPE until later dates in the next upcoming maybe this weekend, next week sort of thing. We weren't last week because they the fit mask testing that you have to do to test that the mask is fitted properly, that there's no air coming in or out. They stopped that completely because the masks then got changed. So that was all a bit of a faff and everyone was freaking out a little bit because now it's a different mask and no one's fit mask tested. But it's a sort of, it's like a one mask fits all type thing that they've said.
Well, we are in a situation now, Kaylee, where guidelines, especially for healthcare workers, they're not just changing on a daily basis, it's almost on an hourly basis now, where it's very difficult to keep up and very difficult to even know what's going on. I mean, I was reading something this morning and I checked my WhatsApp a few hours later and there's new guidelines, and it's really mentally exhausting to keep up, to have to understand okay, I used a surgical mask yesterday in this specific scenario, but today they're telling me that in that same specific scenario, I should have been wearing another mask. And it's like, well, I just don't know what to do now. And
exactly. It changes literally every day.
Yeah. How do you feel working as an NHS worker right now? I understand that we're all going in to fight this virus and to help with this pandemic, help our patients. I fear that we are running on fumes now. We're running on the last bits that we have because we're still not at the peak. The peak is still to come. How do you feel emotionally? How do you feel in terms of the work that you're doing? Because we all go into work as NHS workers every day, willing to save lives, willing to help the public. Do you think you'll be able to sort of maintain that energy level for longer?
Yeah, I think every day for me is different. Sometimes I'm literally sitting up at lunchtime and if I'm sitting on my own, I go through stages of thinking, of sort of forgetting that any of this is happening. And then all of a sudden I'm like, oh wait a minute. I'm fighting like this massive thing and I'm just sitting here like on my own. I just, you just have those moments where you just completely forget.
Yeah.
And then you just walk back in from your lunch break and you're like, oh yeah, this is what, this is my everyday life.
Yeah.
I think I go through days of being super anxious, like probably what I'm going to be like tomorrow after a night shift. You feel tired and exhausted anyways, let alone being in a sort of, in a inverted commas, dirty zone of COVID land, and what we call it. I have my good days and bad days. Some days I feel great. Some days I'm like, I feel so proud of myself to be in this position and to be helping people and stuff. But then other days you don't feel so great. And I think that's just part of working in the NHS anyways, but even more so now.
Well, that's the thing, Kaylee. I think you made a good point there. As part of working in the NHS anyways, it's that line that you just said. I think it's something that people need to understand. This is our life.
Yeah.
This is what we do on a daily basis. And it's nice. It's amazing to see the gratitude that people have, the public, the community.
Yeah,
but
definitely.
There's still a part of me that just wishes that this was always there. We see
what I think as well. Yeah,
we see people suffer on a daily basis. We see people die on a daily basis. We see the worst of human life in the hospital. And my personal fear is that this gratitude and this love for the sudden love and burst of energy for the NHS, my fear is that it will be short lived. How do you feel about that?
I was literally saying that to my colleague yesterday. I was saying, it feels so good that people are clapping for us and people are finally, we're getting the recognition that we sort of deserve.
Yeah.
But I wonder how long that's going to last, like when this hopefully, God willing, all, finishes and everything goes back to, whatever normal will be.
Yeah.
That whether people will remember all the people who came back from retirement and all the people who came into work early from, university or whatever, all these different people that are, contributing, all the volunteers. And I wonder how long they'll remember. It's sort of like in the past, with people who remember the people who went to war and this and that.
Yeah.
It's, I think we will take it for granted, I think, again.
Yeah. That's just how it is, because right now people are just focused on one thing, which is to get rid of this virus. And
exactly.
that's the national focus now. That's the national talk.
Mm-hmm.
It's taken over every conversation. It's taken over every bit of media that we consume. And maybe in the future, slowly, our stories will come out and our stories will be shared.
Yeah.
Because I think we need to be well protected. We need to be in the right frame of mind to help these patients.
Yeah. Exactly.
And I think that's what people are missing. Like all these tests, all these cures, all these hospital beds, fine. Open more hospitals, have more beds available, great. But you need the staff to run it. You need people who
need to think about us as well.
Yeah, you need to have people who have a good state of mind, who are not exhausted, who are not stressed and are not anxious. So thank you so much for joining me today, Kaylee. I really appreciate it. And I hope you stay safe. I hope you have a good shift today and tomorrow as well.
Thank you very much. I hope you stay safe as well.
Thanks, Kaylee.
Just a reminder to people as well to stay at home for us as well as themselves.
Yeah.
It's really important. So important.
It's all right, Kaylee. I saw people on the streets today and I shouted at them. So just telling everyone to just stay away, keep your distance. So so thank you, Kaylee. As you can see, it went from 0 to 100 within just 1 week. We got hit by a tsunami. We had no precautions taken by our government to protect us. And Kaylee is going into her shifts with uncertainty and anxiety about what she's going to face. And I hope all healthcare workers manage to pace themselves during this difficult time, because it is a marathon. It's not a sprint for us. So medical students have also been called in to work for the NHS, and it's incredible to see how keen they are to help and to be a part of their workforce. And I think their energy and their enthusiasm is exactly what we need right now, because they're coming fresh off the boat. So it may get to the point where they may have to assess acutely unwell patients and work outside their comfort zone. But my next guest, who joined me just in between his shift, actually, he was having his lunch break, and I disturbed him to quickly just get on a phone call with me. He seems to be quite optimistic about it, and he's happy to help, and it's really, really nice to see the energy that's coming through. So you're currently being asked to come into the NHS workforce at the moment. Which department are you working in?
At the moment, I'm attached to the cardiology department.
Okay. And is your role basically what an F1 or a junior doctor would do in their first year, or have they been quite compassionate and understanding with your position and slowly sort of introducing you into the NHS?
Yeah, they've been very understanding, and whilst the idea is to eventually have us working at a near F1 capacity, at the moment they are just slowly introducing us to the role, and they've termed us as F0s in a way.
Okay.
And we're going to keep getting the training.
Yeah. And what are your daily tasks right now?
At the moment, they're focusing on the training, so they're very uncertain as to what our actual day-to-day role will involve, what with the uncertainty just around how much strain COVID will put upon the workforce. But we can expect to be helping with ward rounds and doing basic jobs such as blood, things like that.
Mm-hmm.
There's talk of having us in a role of assessing patients, and I think mostly this would be assessing patients such as before procedures rather than necessarily an acutely unwell new presentation. The structure though is different in that what they think is that in terms of consultants, SHOs, regs and juniors, they think the SHOs and regs will be completely gone, but they've brought back a lot of academic consultants. So the new firm structure will be that actually there'll be quite a lot of us theoretically on the ward, but we'll also have a lot of consultants who've come back who can give us one-to-one support.
Yeah. Are you worried that at any point you will be asked to do things out of your capacity and maybe even asked to go into places like A&E or ITU to help with the crisis?
At the moment, we're not worried about that at all. Everyone on the program has been really keen to stress that it's entirely voluntary and they would never make us do anything beyond our comfort zone. And I think from a kind of hygiene perspective, they're quite keen to reduce the amount of cross-contamination and so keep us isolated to one ward.
Yeah. And how does it feel like as a final year medical student? I can't imagine if I was in that position where I would be like right at the very end and then this whole thing has just turned it around. I mean, what's happening with your exams in terms of your qualification? Have they basically qualified everyone as a doctor now?
Yeah, I guess you could say we were lucky in a way in that our hospitals, at least, we already passed our exams about 2 months ago now.
Okay.
So from that perspective, there was only a few real blocks of stuff before we would have hit the ward as a proper F1 anyway.
Mm-hmm. And what is your biggest fear right now with what's happening in the pandemic? Are you concerned about your safety as a doctor? Are you concerned about the safety of your patients and the capacity the NHS has?
I think concern-wise, to set the scene first, at the moment it feels quite weird in that this is very much like calm before the storm.
Yep.
Everyone says that it's 1 or 2 weeks from now when everything will hit and will become flooded with patients. I think I would be concerned about the system becoming overwhelmed and there just not being enough care. But I'm also reassured by the idea that there seem to be a lot of plans in place. I'm seeing a lot of places converted into wards which have ventilators, and we're getting regular communication from the director of the medical school as to what exactly is going on.
Mm-hmm.
I know it might sound like a bit of a wishy-washy answer, but I think really it's just the uncertainty.
Well, I think everyone has wishy-washy answers right now. Even the government has wishy-washy answers. Nobody has anything set in stone. No one's certain about what's happening. But right now, you sound quite optimistic. You sound quite reassured that you have the support. How do others around you feel right now? Other students who've been asked to come in.
It's quite interesting. I think everyone essentially is keen to help. And as you say, it's a bit weird when you're in your final year, in the sense of you're not really qualified, but you feel as if there's something you can do. And most people I've spoken to kind of feel that they have an obligation to help in some way. And the medical school have also restricted it so that only final year students have patient contact. But I think the lower years as well are quite keen to help out in admin roles and things like that. I'm really sorry. I forgot. What was the phrasing of the question again?
No, my question was, how does everyone else feel around you? And I think you answered that to the best of your ability right now, because we all are in a position where we're at the start of everything, right? People's feelings will change on a daily basis, and you have to understand that as well. You know, like right now you're reassured, you've got people supporting you and stuff, but if things do go out of control, that might change. And you might go out of your depth, because even just starting as an F1 as a junior, you're just thrown into the deep end, and everyone knows that, everyone expects that. But right now it's obviously a pandemic we're dealing with death. So what is it like in terms of your practice to license? Because obviously as an F1 or any junior coming into the country right now needs to have a license and to practice medicine. Do you have that right now, or do you have something that's provisional?
So I'm not sure how much you've heard about it necessarily, but the official stance is that at the moment we are working as medical students. So
right. Okay.
From the GMC perspective, the work we're doing at the moment, especially for someone like me who was away abroad as part of my clinical attachment, that this counts for part of my domestic attachment.
Okay, fine. So you're not expected to get paid. You're not expected to be part of the workforce in that way.
Well, there is a change coming, or at least we think it's coming, in that there's a lot of talk around the GMC graduating us early, and this could be as soon as 1 week from now, potentially.
Oh.
Yeah.
Wow.
Yeah. Although obviously I somewhat doubt it'll be the kind of graduation where we can...
It's not the graduation your parents dreamt of when they sent you to medical school 5 years ago or 6 years ago in some cases. But thanks for your time today, and I hope you get the support that you need. And it's a big thank you from everybody, not just from myself, from everybody working in the NHS and even in the community as well for everything that you're doing to step up. So take care of yourself and stay safe.
Thank you.
A seriously big thank you to all the retired doctors, nurses, and newly qualified students who've come in to step up for the NHS and for us. None of this would have been possible without you. We're working at a scale that's unimaginable. And if we didn't have the support of you guys, then none of this would be possible. So my last friend to join me today is a psychologist working in a prison, and he's also had to work from home now, but it's very difficult because a lot of the inmates require a daily structure. They require a plan on a day-to-day basis to keep them going and keep their mental health going as well. The inmates are also on lockdown now. They're also practicing social distancing, so this is going to affect them on a big scale as well. He's also very aware of the impact this is going to have on doctors working on the front line. Doctors will leave this pandemic having nightmares, having flashbacks, because it's going to get to the point where we will have to decide which patients will require a ventilator and which patients may have to be left alone because of the lack of resources available. I think now we realized, I think a lot of us have come to terms with the fact that we haven't had that support from the government. And you have to, at some point, just come at peace with that, right? And realize that that's the case. That's what's going to happen. Even for the last few days, they keep talking about sending us equipment, and we're still not seeing what the government has promised. My husband was saying that they're still being a bit stingy with surgical masks at some times. But even though the management is telling them that we have enough. So it's just like mixed messages from everybody. We don't know what's going on. Now we're facing that as doctors, as healthcare workers, as psychiatrists, everyone working to make this better. We are receiving all these mixed messages, but we can imagine the fear from the public because they don't have the medical knowledge we have. They don't have the access to sort of what's happening day to day that we have. You know what I mean? They're limited to what they see on the news. They're limited to what they hear from other people, but we're seeing it live every single day. As a psychologist, what impact do you think this is going to have on people who are already suffering with mental health problems, who are already suffering with anxiety? What do you think? What's your prediction in the next few months? And if it does get to a point where people are really struggling to overcome this unprecedented time that no one expected, can our healthcare system, can the NHS, can the sector manage to take care of everybody?
Gosh, well, I think there are two answers to that. One, I think in terms of how people are managing their mental health care in the day-to-day, I think there are a lot of steps out there at the moment in terms of trying to manage people's anxiety, try and stay grounded, engage yourself in sort of grounding techniques, mindfulness activities, breathing exercises, those types of things, and try and drown out those big existential cataclysmic issues that people seem to find themselves in, especially the things that sort of accelerate health anxiety issues. So loss of sense of control and so on and so forth. And you should try and spend some time thinking about the things that you are in control of and the things that you can do, and trying to alleviate some of that sort of symptomology. With regards to what's going on with the wider picture, I think there is going to be a continued mistrust and distrust of of the people in charge.
Yeah.
Absolutely. That's all I can say is that I think there's going to be anger towards the NHS in the future with regards to, you didn't help us. You put, like, we're in a threat state. We look to you for guidance and for help. And if your system's falling apart, that's one thing. I think at one level we're going to see that backlash. And I think in some instances we've started to see it. But at another level, that's beyond our control. And I think that's going to be something that permeates in the future. Is for people going to turn around and say, well, hang on, at one point you didn't give your NHS staff anything.
Yeah.
You didn't give them the PPE, you didn't give them the funding, you didn't look after your nurses, you didn't look after your healthcare assistants. You have consistently placed them under scrutiny and stress and strain, and you put the healthcare service into a shock system, basically, and that's what's happened. We're in a state of shock. So we are doing as healthcare professionals, we are doing as we're supposed to do, but we're in a state of shock and panic at the moment. So, and I think that's something that, in hindsight, people will see, especially those who are service users as well, because they use the services. They can see as well as we can that we're under massive stress and strain, and it's very difficult for us to be able to provide care for people when we're in a situation where we're not able to. It becomes very difficult. So these are all kind of the systemic problems, I guess.
Because the thing is, Jazz, I think now we understand that this virus has hit us. We understand that it's gonna get worse. It's not gonna get better, unfortunately, and this is why they're building hospital beds in the XL in London. This is why they're preparing us in that way. But we have to still continue to look into the future, right? Obviously tackle the problem now, but the lack of foresight they had a few months ago, I hope we don't have that again. And I hope that doesn't impact us again in 4 months or 5 months' time.
Absolutely. I mean, I hope there's enough foresight to be able to think about how we are coping with things going forward. Because when this is all said and done, there's going to be a lot of, I look at this from a psychological perspective, but there's going to be a lot of trauma as a result of this. So people are going to have post-traumatic symptoms. If I talk about it from a healthcare professional perspective, we are looking at doctors and nurses who are going to have to make clinical decisions on who lives and who dies. And that's kind of, in some ways, I suppose you're trained for it, but it's also anathema to sort of the Hippocratic Oath and the whole thing about preservation of life, and who you are as a person is about trying to protect people. That's going to be a consistent threat towards yourselves. So me as a psychological professional, I'd be looking at that and going, right, okay, so how do we provide the correct sort of emotional and psychological environment for you guys to be able to explore that safely?
Yeah.
And that's as a result of what's going to happen. But, that's looking years down the line. That's looking, maybe a year or so down the line. After the dust has settled, you can't do any psychological work immediately like that. That's as a result of what's going to happen now, and that's kind of where I see it. So,
yeah, I know, Jazz. I think the issue right now is that we're frustrated that there was lack of foresight before.
Absolutely,
we're frustrated that there's still lack of foresight in the future. And as you said, you made a good point that this is going to affect our systems as healthcare workers, as hospitals, in years to come. And I just hope people really understand that, I understand people are trying to be optimistic and things will get better. Yes, things will get better. They will slow the number of cases down. Less people will die with this virus. There will be less suffering in the next few months. But the impact that this is going to have on you, people like me, is scary. And I honestly think, Jazz, that after all of this, we're just going to go back. I'm being pessimistic with the government and everything, but I just think we're going to go back to square one where we were before, where the government doesn't respect us as workers, doesn't care for the NHS workers. We'll still be getting our crappy pay that we get, working nights, working long days, and this. this love for yeah.
Go on.
I was going to say this love for the NHS and all this gratitude is great. I'm very, very happy that people are understanding who we are and what we do. But my biggest fear is that this will be short-lived.
Yeah, I share similar concerns, which is why I think it's very important that once we're in a position where we advocate for absolutely everything we can, and we hammer home just how difficult this is going to be.
Yeah.
Because this is going to affect us all, like from a professional perspective. I know so many people that work across different sites and different trusts, and I've got real fears that maybe one or two people I know are actually going to pass away as a result of this.
Yeah. I speak to my family in India, and I speak to a lot of my friends, and I do have a very negative tone all the time. And I try not to, Jazz, because I don't want to scare people. I don't want to terrify anybody who's not medically trained, because if you don't understand the medical side of it, then it's difficult, and I get it. Like, as doctors, we have to show that compassion and empathize that not everyone is in the same boat as us. And that's what being a doctor is about, right? Like trying to explain medical terms to the layman. But it's really difficult to do that now. I'm really struggling as a doctor, as a daughter, as a niece, as a granddaughter. How can I make you feel better? How can I comfort you in a time when there's little comfort available, So, Jazz, I just hope that people like you are protected in the future. I really hope that there's not going to be a burden of work in the next few months, but it's very likely that there will be. You're going to have doctors knocking on your door. You're going to have nurses knocking on your door with post-traumatic stress disorder. You're going to have so many people.
I'm very much preparing myself for probably the next 4 years, 5 years.
Yeah.
I'm very much looking long term, but that's how I think. I'm a very systemic thinker. So I will sort of look at systems and how they play and how they interact and improve them and make them better, and how that affects individuals at an individual level.
Yeah. I might show up at your door, Jazz.
Because that's the way. Thank you. But because that's the way I think. Like I'm looking at in terms of the long-term impacts of what this is going to do to people, and how this is going to affect us moving forward.
Yeah.
And I find it interesting that with regards to the Lancet paper that came out from the doctors that were in Wuhan, that were dealing with the initial crisis, and the way they were talking about actually they didn't really want psychological help at that point, at that time. So I'm very much aware that maybe our role in the future is going to be, a couple of years down the line, when all the dust has settled from all of this, and people are really dealing with those elements of who they are, the existential elements of who they are, and those conflicts and contradictions that they've had to deal with through this crisis period.
Yeah. Because I think
that's going to be where our work is trying to help people navigate that, because, as I said earlier, this is going to be one of those situations where a couple of years down the line, people are going to have post-traumatic stress disorder as a result of what's happened. And I can't nullify that any less right now. Like, it's quite a brutal way of talking about it, but I don't think there's any other way of putting it. This is what's going to happen.
I think, Jazz, the main issue, and I think a lot of doctors will echo the same thing I'm saying right now, but we are sort of questioning our roles as doctors, right? We're supposed to be saving lives. We're supposed to be putting patients before ourselves, and we're doing all of that. But people are still dying. People are still suffering. And it's not because of us. It's not because we're not doing the right thing. It's because we just haven't been prepared for it. So we question our, our own skills as a doctor. We question our own knowledge as a doctor. Like, am I a good doctor? I go into work most days, and there are times where I feel like I can't do anything, and I just think, am I a good doctor? But we just have to remind ourselves that we are working in a system, and it's a system that's controlling us. And if the system doesn't help us, we're limited to what we can do. So I hope that things get better over the next few months in terms of the virus. The virus will settle, and I'm sure it will. And not just here in the UK, but across the world as well. Things will come, everything will come under control. But I think it's just really important that everybody understands the impact this is going to have. And you made a good point in the not just in the next few months, in the next few years as well. So thanks for joining me today, Jazz. I appreciate your time.
No problem.
No, thanks. So that was today's episode, and I hope this gives you a better idea of all the different healthcare workers who are working to save our communities. Please don't forget us in 5 months' time, in 1 year's time, when we may need your help and support again. If there's anything else you want me to talk about next week, you can find me on Instagram at Meanles_world. You can also email me if you go to my website. It's meanlesworld.com. I'll be happy to answer any of your questions and keep you updated. Things are changing on a daily basis. We're trying to keep up with everything. And I'll be back with you next week as well with another update on what's going on. And I hope these episodes are helping you stay informed on the pandemic. And if there's anything specific you want me to talk about, just drop me a message and I'll be more than happy to record anything that you need. So I'll see you all next week.